Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. My dear friends, you can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order and you can make use of it. Friends, as you know, we are discussing about approach to fever in children. Already we have covered almost 11 or 12 parts, the basic parts of this fever, and we are actually discussing about the 5 or 6 questions that every pediatrician has to ask with the parents: onset of the fever, response of the antipyretic, then about the interfebrile period. These three are over. Now today we will discuss another important question that you need to ask with the parents is rhythm of the fever. Okay, rhythm of the fever, that is very important. Now first of all, you understand what do you mean by rhythm of the fever. Suppose mother is telling that, see doctor, every time I give him the antipyretic, for the next 2 hours he will be okay, and then again he start with the fever. This is a complaint of the mother. Okay, so once I give the antibiotic, for the next 2 hours he will be okay, but again he start with the fever. And again she says that in a day or in 24 hours such 3 or 4 episodes are coming. Okay, 2 hours there is no fever, again there is a fever, again you give the antibiotic, again there is no fever, again after 2 hours again it starts. So what I mean to say is this is called as a rhythm of the fever. Okay, so if the mother is complaining like this, that suggests that this particular fever is maintaining one particular rhythm. The fever is coming in every 2 hourly, fever is coming in every 3 hourly or 4 hourly. Okay, so fever which maintain the rhythm every time in 3 important conditions. Okay, so fever is maintaining every time the fever is coming in a rhythm. So that is possible in 3 important conditions. You should be very careful. Number 1, viral infections. In viral infections, most of the time fever comes in rhythm. Once you give the antibiotic, the fever comes down, again the fever starts after 2 hours. And every time the same thing happens. So this is called as the rhythm of the fever. Similarly, in even bacterial infections also, fever comes in rhythm. Okay, and even in case of immune mediated reaction or immunological fevers also, the fever comes in rhythm. Okay, and only one condition where fever is not maintaining a particular rhythm of 2 hours, 3 hours, 4 hours, etc. Malaria like parasitic infections, they never maintain the rhythm. The parasitic infections, they never maintain the rhythm. In parasitic, as I already explained, the nature of parasite, whenever the parasite at once get burst open from a cell and release into the blood, sudden immune reaction start and the fever starts. So this burst open time of the parasites, for example from the RBCs in case of malaria, is not a fixed one. It is not a fixed one. Okay, when a sufficient amount of the offsprings are formed and there is no space, then they burst open. Okay, it is not a fixed one. Therefore, parasitic infections, they never maintain the rhythm. Other 3, so they always maintain the rhythm. So therefore we say that rhythm is irregular in parasitic infections, whereas rhythm is regular in case of viral, bacterial and immune mediated reactions. Okay, now we have to differentiate viral, bacterial and immune mediated. Now all the 3 we are getting the rhythm. How to differentiate whether it is a viral, whether it is a bacterial or whether it is a immune mediated reaction? That we'll see now. Now, first we'll see rhythm in immune mediated reactions. Okay, in immune mediated reactions, usually autoimmune disorders. Okay, immune mediated or immunological fever means autoimmune disorders. Our own body immune system confuses with the body cells with the intruders. Our own body immune system think that our own body cells, it will treat our own body cells like the bacteria or virus or any other pathogens. So parents usually complain it one important thing. What is that? See, this is very important to understand the rhythm in case of immunological fever. In case of immunological fever, the interfebrile period is long. What I mean to say is, see, in viral fever, usually parents say that fever coming in every 3 hours. Okay, even in case of bacterial fevers, so usually parents say that fever is coming every 6 hourly or 5 hourly, 4 hourly, etc. But when you talk about immunological fever, the interfebrile period is very long. Interfebrile period is very long. Fever coming in every 12 hourly. Rhythm is maintained, but that rhythm period, interfebrile period is very long. Fever coming on every 10 hourly. Fever coming on every 12 hourly. So like this. Okay. Every day morning to evening he will be okay. But night 8 o'clock or 10 o'clock he will start with the fever. Every day. So that means that interfebrile period is very long. Although rhythm is maintained, interfebrile period is very long. See, tuberculosis, basically the tuberculosis, although we say that it is an infectious pathology, okay, it's a bacterial infection, no doubt, but still it is considered under the immunological fever actually, because it is the body immune system which is actually playing a very important role there. Okay, you can see in adult type of tuberculosis also, where the fever is coming with a long interfebrile period. That means, see, every day, night hours the patient start with the fever. That means throughout the daytime there is no fever. Only at the night hours he start with the fever. So that is the interfebrile period is almost all more than 18 hours. So that's a typical nature of immunological fever. Any autoimmune disorder, it may be SLE, it may be Kawasaki disease, it may be any other autoimmune disorders. Okay, so where the fever is there, that fever follows this particular nature. What is that? Long interfebrile periods. That means fever is maintaining a rhythm, but it is very longer. In bacterial and viral infection, also there is a maintenance of the rhythm, but fever will be there for 3 to 4 hours or 4 to 6 hours of interfebrile period. Short rhythm will be there. The rhythm is very short. Okay, whereas in case of immunological conditions, long duration or long rhythm will be there. Okay, so in malaria, as I told, malaria never maintains a rhythm, so it is erratic rhythm. There is no rhythm at all. Okay, so regular and every 10 to 12 hours the fever is coming. Okay, so here the fever is regular and it is coming in every 10 to 12 hours or sometimes 12 to 14 hours gap. So if the fever is coming like this, definitely you can think of the fact that this is not an infective fever. Definitely this is a non-infective fever. Okay, immunological fevers are the example for non-infective inflammation fever. Okay, infection is not directly doing anything. Our body immune system itself is damaging our tissue. Therefore, there is a non-infective inflammation and there is fever. Okay, so make it very clear by this question. If the mother is telling that fever is coming with a long duration gap or long gap, okay, of 10 to 12 hours, once in 24 hours or once in every 12 hours. So this type of pattern, if it is seen, definitely it is an immunological fever. Which type of immunological fever, that we have to discuss later. Okay, but one superficial category we can make that this is definitely a immunological fever. This is something related to autoimmunity or some other immune deficiency or something like that. Okay, so immunological always maintain a long interfebrile period. Any type of immunological conditions, malignancy. See, malignancy is also a deranged or aberrated immunology. Okay, a patient of leukemia, why he should get fever, isn't it? So actually there is no infection, but still he got the fever. It is a non-immunological. It is not non-infective. That means it's also a immunological fever. There is also a derangement in the immunology of the body. Okay, so it will be always a long duration. Even in case of rheumatoid arthritis, then rheumatic heart disease, there also the fever comes in long interfebrile period. Okay, so this is very important thing, so that such a rare disorders also you can identify on the day 1 or day 2 itself. Okay, which requires a lot of investigation, but clinically you can diagnose that in the day 1 or day 2 itself if you take a proper history. What you have to do is you have to take about the rhythm. Long interfebrile period, always it is immunological. Short interfebrile period, always it is either bacterial or viral, mostly viral, other or bacterial. Okay, and if there is no rhythm at all maintained, so definitely it is a parasitic. That's all. So about the rhythm in immune mediated reactions, further we say, see, autoimmune problems are misdiagnosed as infections many times. So basically we have to understand this. When I repeatedly telling immunological fevers, they are basically divided into three types. Number one is immune reactive, another one is immune disorganized or immune deficiency. Okay, immunological, it includes three things. Immunological fevers can occur because of three types of immunological problems. One is immune overactivity, exaggerated immune reactions, okay, which we call it as autoimmune disorders. They are like Kawasaki, okay, then periodic fever syndrome and SLA-like syndromes, glandular fever, SLE, etc., IgA nephropathies. So different types of hyper immune reactive disorders where particular autoantibodies are produced against our own body cells and it will go into destroy it, and we know the fact. This is one type. Another one is immune disorganized. That means here there is no any over excitation but disorganized. That means in case of malignancy leads to fever. It is actually immune disorganization. We will discuss later. Okay, okay. In case of any stomach cancers or renal cancers or blood cancers, leukemia, etc., you will have the fever. Okay, mild fever will be there. That fever is not because of the infection. That fever is because of the immune disorganization. Similarly, immune deficiency. Immune deficiency may also lead to repeated fevers. Okay, so as we witness in case of HIV or isolated or combined immunodeficiency, T cell, B cell, or combined deficiency, cell deficiency. So low CD count and all in case of HIV. So these are the three types of immunological fever. Okay, in all the three types the pattern is same. There will be long interfebrile period. Okay, once you diagnose that, yes, this is of acute onset. Yes, onset is acute, suddenly it starts, but it maintains a rhythm, but that rhythm is a what you say long interfebrile period. Okay, it's a long rhythm, and response to paracetamol may or may not, or response to antipyretic sometime it may give or some may not. Okay, so this is how you have to differentiate. So this is all for today. In the next class, we will see the next question, progression of the fever in the next few days. On the day 1, day 2, day 3, day 4, when you see what is the progression of the fever, that plays a very important role. So 4 questions already we have covered. Onset of the fever, response to antipyretic, then comes the interfebrile period, then comes the rhythm of the fever. Now we shall see in the next class, that is about the progression of the fever. Thank you very much.